We're going to get started. Welcome everybody to our 15th virtual shadowing session. I am really honored to present to you today a veterinary dentist, Dr. Keith Stein. Welcome.
Hey, am I up?
Yes, you are.
Okay, so thanks everybody for attending. And thanks Nina and Jason for even asking me to be part of this. One thing I didn't tell you guys in the pre-meeting, I'm a little bit under the weather. And so if I stop to take extra sips of water, just bear with me. But anyway, yeah, I am a board certified veterinary dentist and oral surgeon. And we'll talk more later about how that came to be, or how it would come to be for anybody. But there's about, I think now there's up to about 185 of us worldwide. So it's a fairly small group where we kind of tend to know each other. But that's what I do. I was in general practice for quite some time, but and we can get into all that in terms of the pathway. But I went to make a PowerPoint, or a slide stack, I guess is what the kids call them these days. And I thought, well, I don't want to just reinvent the wheel. So I just went through my PowerPoints that I've built up kind of over the years of doing this, and picked one that I thought would kind of highlight what I do. This is a PowerPoint that I would give when I would go out into my referring clinics and lecture. I operate by referral only, as most specialists do. And what typically happens is general practitioners and their staff are always looking to improve their skills and get better. So they would invite me or somebody like me into their practice to give a lecture. And I put this one together to kind of help them assess where they are, and bring up some points just for training them. And so I thought it'd be a good way to introduce you guys to some of what I do as a board certified veterinary dentist. Did you guys hear that? The bark? Okay.
Yeah.
I have two awesome dogs, Fosters, available for adoption. So if they see somebody outside, they may bark, but we'll get past that. I don't know, is there anything blocking that? It's kind of blocked on my screen.
I think it looks fine.
Yeah, okay. So a lot of what we do is kind of what you think that we would do based on trips to your dentist. Scaling and polishing is kind of the basic dental work that any veterinarian is going to do. I kind of do that as my baseline. For those of you who have shadowed any kind of a surgical practice of any sort, you have to clean, you have to scrub and prep the area. So the scaling and polishing, like what we do when we go to the dentist, that's kind of my scrub, my prep for the oral surgery that I'm going to have to do. And a lot of what goes on with specialty dentistry is beyond just scaling and polishing. And it's mostly periodontal work. Root planing is using hand instruments to go deep into the gum, into pockets that form around the teeth, and clean those areas out to help reform or provide an environment that'll help reform that attachment of the gums around the tooth. Subgingival curettage is kind of the same name for a different part of that process. But gum tissue can overgrow and create pockets around the teeth. So gingivectomy, gingivoplasty, those are oral surgical procedures of recontouring the gum tissue so that we can take away any propensity for abnormal dental issues. Osteoplasty, bone graft, ridge augmentation. There's extractions is a lot of what we do, but there's also a lot that we can do to save teeth. If we have a client that wants to invest the commitment or make the commitment, which is generally time and money and anesthesia for their pet. So bone grafting and ridge augmentation, that's the ridge of the mandible or the maxilla, the bone that holds the teeth in. Gingival grafts for areas where the gums receded. Splinting to help realign teeth and solidify teeth that are otherwise mobile. And that's a lot of the basics of what we do from a periodontal standpoint. but we also do endodontics, root canals. If you've ever had a root canal, you know what it is. If you haven't, the inside the tooth is the live tissue, the nerve, the vessels, and some connective tissue. So a root canal, when something exposes that nerve or causes it to die, you can still keep the tooth in, but you have to go inside, clean out the live tissue, or what once was the live tissue, and then pack it full of endodontic materials and put a filling on the outside. So that's root canal therapy. Surgical root canal therapy is, and I've got some pictures coming up, so I know this is kind of the boring part, I hope. Surgical root canal therapy, if you've got an abscess tooth, we can go in surgically and remove the bottom of the tooth. The apex is what it's called, where it sits in the socket, and then put a restoration there, and then pack it and do a root canal so they can still save the tooth. Vital pulpotomy, if you have a freshly fractured tooth, we can do a live pulp procedure where we keep the tooth alive and we don't have to do a root canal. That's the pulpotomy and the pulp capping. Apexification, yeah, we don't even worry about that. And I am, by the way, I'm going to skip some of these slides as I go through here because we don't need to get too technical with some of this stuff. Avulsed or luxated teeth, we do see those more often than you would think, actually. A luxated tooth is something that's still in the mouth. It's dislocated, basically. So it's at an angle because of some injury that's happened to it. Avulsed, it's out of the mouth and clients bringing it to you in their hands. And we can't actually put those back in and save those teeth. There's a process for cleaning that area up, putting the tooth back into the socket, the alveolus, and then splinting it in place, and then coming back and doing a root canal a few weeks later. So these dogs or cats can keep the teeth. Restorative, we do see cavities in dogs. Mostly it's large dogs. And when they do occur, we can fill them. We can drill them and fill them is the term. And we can let those teeth stay healthy. Enamel hypoplasia, there are some developmental defects that occur in teeth. And enamel hypoplasia, or a deficiency of enamel, the outer covering of the tooth, can be something that we see, and we can put restorations in those areas that are deficient. And it helps strengthen the teeth a little bit. It also helps prevent some of the stain from being picked up quite as quickly in those teeth. Most of what I do is oral surgery. Excuse me for a second. If you've ever had your wisdom teeth out, you know that there's a process that goes along with that. Simple extractions would be like the incisors, those small teeth that you see up front, the single rooted teeth. Surgical extractions actually involve kind of like the wisdom teeth, making incisions in the gum tissue, creating a surgical flap to expose the bone of the maxilla or the mandible, and removing some of the bone from around the roots, hemisecting the roots, and then elevating each one individually. We get pretty much all the fractures in and around Nashville get referred to us. We have a lot of hit by cars, hit by baseball bats, kicked by a horse, playing with another dog. So we do see a lot of jaw fractures, and they get referred to us. We use wires primarily. We use acrylic splints. If you've ever worked with any orthopedic surgeons or heard from orthopedic surgeons, plates are something that can be used on the maxilla and the mandible to fix fractures as well. TMJ, dogs and cats are not immune from getting TMJ issues and developing severe arthritis. And that can occur of its own accord. That can occur secondary to a traumatic incident, luxation of the TMJ. So removing the condyle, which is the back part, it's the hinge part of the mandible that connects to the skull. That's the condyle. So removing that can alleviate some arthritic symptoms. Cleft palates or nasal fistulas, which is a communication between the oral cavity and the nasal cavity. Oral tumors, we do a lot of oral tumor surgery, oncologic surgery. Removing portion of the upper jaw or portion of the lower jaw is the way to do that, because with any tumor surgery, you've got to remove a certain amount of normal tissue around it. So we wind up getting a lot of those procedures sent to us. So ranula is basically a salivary gland issue. Those can be repaired surgically. Not all need to be, but they can. Prosthodontics, crowns. We do crowns in animals. Mostly we do those, I do those in working dogs. We do a lot of work at the Nashville Zoo. We've worked on a lot of really interesting and large animals, but we do treat most of the canine officers in this area, so police dogs. And they're trained, most of them, to do bite work and bring the bad guys down. And they do a lot of damage to their teeth. And even before they break, we can help strengthen them with these 3/4 crowns that don't wrap completely around the tooth. But when they break the teeth, the officers are interested in keeping the teeth. So we can treat them endodontically with root canals. We can put crowns on top of those teeth to help keep them in service as long as possible. Orthodontics, we can move teeth in animals. I have used braces on dogs. Yes, it's stupid. So I don't really recommend that. I've used braces on dogs actually to help stabilize jaw fractures. But there are some malocclusions that can occur. Shelties are particularly prone to having their canine teeth kind of pointed forward. And we can put braces on the teeth to kind of pull that back into position. A lot of times dogs' canines, the teeth on the bottom are too narrow, and so they poke into the roof of the mouth. And we can move those teeth outwards so that we can alleviate the pain and discomfort and prevent bigger problems down the road. And then emergency dentistry. Certainly any animal that's been involved in a traumatic episode or any kind of is in any kind of emergency situation, they need to be stabilized and assessed. Generally, the teeth and the oral or maxillofacial trauma are not top priority, but they're a part of overall treatment planning. And if somebody brings a dog into an ER somewhere, they need to be made aware that, hey, we can get your pet through the initial phase, but once we do that, there are these other things that are going to need to be addressed so you can get a complete plan together and honestly complete estimate for cost. Because unlike on the human side of medicine, most pets are not covered by insurance. They should be, and there's a lot of good insurance companies out there. And if you have pets, I would really urge you to look into that because it's, God forbid something does happen. Most plans are reasonable and they will help you offset some or a lot of the cost of that. So this is last year. This is my son here in the middle. And those are the Harlem Globetrotters. I took my son, we bought the VIP ticket. So we actually got to sit on the bench with the team during the game and help coach them. And then we got to go backstage at halftime and hang out with the team and take a picture with the team. And this is my son. He was, I guess he was 11 then. So it was maybe a couple years ago, but that's us hanging with the Harlem Globetrotters. So that's cool. So when most people think veterinary dentistry, they think, well, clean the teeth, but oral problems and dental problems can be related to a lot of different things. Some of it has to do with the breed of animals. Some of it has to do with what they're being used for, their environment, what kind of playthings or chew toys they have. The occlusion, these smush face breeds like pugs, Boston Terriers, Shih Tzus, French Bulldogs, those teeth tend to be crowded and rotated, which can accelerate periodontal disease. Some animals have extra teeth, supernumerary teeth, which can cause crowding and cause other teeth to kind of move into abnormal positions. Persistent baby teeth can do the same thing and need to be addressed. The use of the animal, like I said, we do a lot of canine officers, also a lot of dogs that are just personal protection dogs. And here in Nashville, there's a lot of, there's a lot of, get down, sorry. The music industry, country music industry is here. So there's a lot of celebrities and, in some circles, it's kind of a status symbol. They have a personal protection dog. And so there's a few companies in town businesses that will train and maintain training for these animals, for these folks. Age, breed, age is not a disease, but certainly as an animal gets older, more things can happen. Trauma, we kind of talked about. Foreign body is a big one. Dogs that go outside and tend to chew on things can break teeth. They can get sticks stuck between teeth, which can cause severe ulceration and even sloughing of tissue. Bone loss, osteomyelitis. Renal disease, kidney disease can lead to, my dog just pushed my chair down. If you have renal disease, toxic substances are building up in the blood, and those can manifest in the oral cavity as ulcerations. So that can play a part. Endocrine disease, things like Cushing's disease, which is an overactive adrenal gland. You get production of too much steroid. Steroids can suppress the immune system, which can lead to an acceleration of periodontal disease. An underactive thyroid thyroid affects, that's a hormone that affects every cell in the body, basically. So if it's not acting up to par, the body's not going to be able to repair itself as well. Diabetes is a big one. Diabetes is known to inhibit the migration of certain white blood cells, which, if you're trying to fight off an infection in the mouth, could be an issue. But also too much sugar running around the blood. Some of that's getting secreted into the fluid that's secreted around the teeth. And that's a good substrate for bacteria to kind of live off of. So I've had actually a couple of cats that were diabetic. One in particular, I remember, we did some dental work, cleaned up the mouth, sent him home. He came back through the ER the next day because now he was all of a sudden hypoglycemic. He was difficult to regulate at first. We worked on the mouth, and all of a sudden his insulin requirements went way down, and he was having a hypoglycemic crisis. So it can really have an effect. Autoimmune problems can manifest in the mouth and the oral cavity, things like lupus, particularly. Allergic conditions. If anybody's got any dogs that have allergies, you would know that what they tend to do is have itchy skin, and dogs that have itchy skin tend to chew on it. So the teeth can be worn down. You can get hair stuck between the teeth or between the teeth and the gums. And I've seen that lead to pulp exposure if it goes quickly enough. Viral is a big one, especially in cats. Feline leukemia, FIV, anything that affects the immune system, which viruses tend to do, can cause a lack of ability of the body to take care of issues that they otherwise would be able to take care of. And chemotherapy, radiation treatment. On the human side of things, anytime anybody's getting radiation from the neck up, usually what they'll do is they'll send them first to a periodontist and make sure they take care of any dental issues. And the same thing should be true in veterinary medicine. And we do use radiation therapy in veterinary medicine. We use chemotherapy, radiation, or chemotherapy treatment as well, which of course is going to suppress the immune system. So either one of those from the neck up, that animal should be treated by a dentist to make sure the mouth is not going to be a huge problem, especially if it's an oral tumor. If you irradiate tissue, it's very frustrating to try to then go back and do surgery because that tissue is damaged and it's not going to heal. So any kind of extractions, any kind of periodontal work is just kind of going to open Pandora's box of problems. So a lot of what we do, and you guys have probably heard this if you've talked to other vets or even other human physicians, and really in life, you know, it's all about communication. The biggest factor in client complaints, it seems to me, at least in the veterinary field, is just a misunderstanding or lack of communication. And it is never too early to start practicing that and honing that skill. If you're going to be in a profession that deals with the public, and I know where you're thinking, well, he's just a vet, but my patients don't drive themselves to come see me. So they arrive with a human, and then I have to talk to that human. And if you've ever done that, you know how frustrating that can be. So good communication skills, a lot of patience is going to be paramount if you're going into any kind of health-related field, whether it's the veterinary field or on the human side. We do a lot of anesthesia. We do here in dental and oral surgery land, and I was a GP for several years, but a lot of what we do is general practice because most of my patients, and I'll tell you, I'll back up, the #1 disease in veterinary medicine by far is dental disease. Probably 90% of all animals 2 to 3 years of age or older have some form of dental or oral disease that needs to be treated. You can take cancer, you can take renal disease, you can take allergies, you can add all those together. It's still not as much, of an issue as dental disease is. And what we do, we bring animals in, generally they're older animals, 12, 14, 16, 18. We've had some that are over 20 years of age. And the clients are always worried about anesthesia. And so I provide for my staff a lot of additional training with anesthesia. We have anesthesia specialists come in before COVID. They were coming in pretty much every other month and spending a couple of days training my staff, myself, and running cases with us. Because, at the end of the day, we want that animal to go home. We want them to feel better. And we're going to do surgery. It's all done under general anesthesia. This I think I just said. And this I said at the beginning. That's the reason for this presentation. Okay, so we'll just go through some pictures. This is a dog, obviously. And, when I go to vet clinics and when I lecture, here's the question: what abnormality is present in this 1-year-old dog? And a lot of these things, you guys, you'll get an understanding of what I do, but you also get a better understanding of how to care for your pets, at least from a dental perspective. So the problem with this dog, and I don't know, can you guys see my arrow on that? Okay. Yeah. So the problem with this dog is he's missing, he's missing a tooth up here and he's missing a tooth down here. He also has a fractured incisor up here, but these are anatomic abnormalities. And what, it doesn't matter if it's human or canine or feline, if there's something that should be part of the anatomy that isn't, it should be investigated. And teeth can become impacted, they can not erupt, they can be deformed, they may just not have had the genetic material, the DNA to make those teeth, and that's fine, but it should be investigated for the overall health of the dog because impacted teeth can cause big problems. They can sit there in the jaw and form cysts that can erode the bone. It's a pressure necrosis of the bone. So dental x-rays is always warranted, even though this is a seemingly very innocuous, very benign issue. Oh, he's just missing teeth. Well, let's find out what's going on. It's always the right thing to do. Here's an example of a tooth that's missing. Here's the canine that's worn down from chewing on something. So that needs to be addressed as well, but there's a tooth that should be here. That's the canine, that's the first, the second premolar. And you can kind of see that discolored area. That's the cyst that's forming. You can see it down here as well. There's a cyst that's forming around a tooth that's not erupted. We call those dentigerous cysts. And this is what it looks like on the x-ray. Okay, and you can see that what's happening is the bone is being eroded. And so now what you've got is a problem that's not just one unerupted tooth, but the bone is eroded around this second premolar. So now it's not just always missing a tooth, it's he's missing a tooth and we have to get that one out. We have to get that one out. That's a surgical procedure. And then we have to enucleate the cyst to make sure that it doesn't come back. And oh, by the way, on the x-rays, that tooth, that canine that I showed you that was worn down and that needs to be investigated, on the x-ray, it's dead and it's trying to abscess. The reason you can tell it's dead, that area right there is the pulp chamber. And if you compare the size of the pulp chamber there to the contralateral tooth, you see it's bigger. So the pulp, as the tooth ages, the pulp lays down dentin, which is the bulk of the tooth. The tooth is covered by enamel, which you can see that thin line there. And then there's pulp here, and then in between is dentin. So as an animal ages, or a person, the pulp lays down, cells in the pulp lay down more dentin. So the walls of the tooth get thicker and thicker, and the pulp will get smaller and smaller. And that's how we can tell the age of an animal based on dental x-rays. And so you can see the size of the pulp chamber much larger here. So we know that tooth is dead. We can look here and see some changes in the root. So it's trying to, you can see the abscess actually right here. Here's just another picture of a dentigerous cyst. You can see the tooth is laying sideways. It's affecting the bone around this premolar and now the canine as well. Is this puppy or a show or a pet puppy? And breeders being what they are, sorry if anybody breeds animals, but they are pretty demanding clients. And they want to know pretty early on, am I going to be able to show this dog? And there's a lot of variation within the AKC about what a breed standard is. But if you look at this puppy, you can see that he's missing a baby tooth. That doesn't mean that there's not a permanent tooth that's going to erupt. But again, he's missing something that should be there. We should investigate. So we take an x-ray and we can see all the baby teeth here. And these are all the permanent tooth buds. They are waiting for their predetermined signal so they can start growing a root, which pushes the tooth out and causes the baby teeth to be lost. And we can count the tooth buds. So 1, 2, 3, 4, 5. We know there should be 6 incisors. There's only 5 permanent incisor tooth buds. So we'd have to tell this particular client it's probably just going to be a pet, not going to be able to show it. And that's valuable information to a breeder. Extra tooth. This is an extra tooth. You can see not a real big deal. Anatomically, it's not normal. Take an x-ray, just make sure it looks okay, but it's just an extra tooth in both of these. This is a dog on the right and a cat on the left. These are my dogs. These are, that's Mushy Quinn down at the bottom, down here, and that's Gracie May. They are full-blooded pits. They're super dogs, great with kids, great with other dogs. And I've been fostering them now for close to 3 years. Yeah, I have tried to find them a forever home, but have not, but those are my dogs. This is an oronasal fistula. Fistula is just a name for a communication between two things. Oronasal means the communication between the mouth and the nose. And dogs are very prone to those, especially dachshunds. The upper canine tooth, what periodontal disease is an infection. It's a bacterial infection that goes unchecked. And it goes down the tooth where we can see it and up underneath the gum where we can't. And what the body does is it sets up an immune response to fight the bacteria. So white blood cells come in to try to fight the bacteria, and they release all sorts of enzymes, and then the bacteria fight back with their own enzymes. What happens is the normal tissue, the gums, the bone, the ligament that holds the tooth in, that's collateral damage. That all gets destroyed in the process. And in worst case scenarios, it erodes through the bone that separates the roots of the teeth on the top jaw from the nasal cavity, and you get an oronasal fistula, which you can see pretty clearly right here. And you can see there's a probe that's about 15 millimeters going straight up into the nose because we probe each of these teeth, and you can see some blood coming from the nose right there. So we do, as a matter of fact, had a really good one of those today in surgery. Here's another example. That's opening the mouth and being able to see inside the nose of a dog by doing it. Food, debris, hair, water, all can get caught up in there. So you can get a rhinitis, sneezing, nasal discharge, epistaxis, or bleeding from the nose. So it's a surgical repair. Here's how we've taken one and surgically repaired it. Abscess teeth. Dental x-rays should be a part of any veterinary dental treatment. This is showing, this is an upper molar in a dog, and you can see this area, this is a lytic area. That's all bone erosion from an abscess in this molar. And you can even see it's got erosion in the root. Think of it like a cavity. It's not the same thing, but it's root resorption around that abscessed area. So we'll pull that, we'll find a big granuloma in that area where the bone should be, a lot of infection. So we'll have to surgically extract that tooth. We see a lot of busted teeth. If you have a dog, please don't let them chew on anything hard. Nylobones, bully sticks, antlers, all those things are really destructive and they will break a tooth. So what we're looking at here is live pulp. It's a dog that's broken his tooth and we have a live nerve exposed. And it's been there for a while. So we go in and look to surgically remove that tooth. So we make a flap. And this is a particular dog that presented with the swelling underneath its eye. Because you have an abscess, it's trying to drain somewhere. And so what it did here around this distal root, you can see it just ate away a hole in the bone and started to try to erupt through the skin underneath the eye. But you're actually looking at the root in the socket through a hole in the bone of the maxilla right there, all because of pulp exposure from chewing on something hard. That one we don't need. Here it is. If you didn't brush your teeth for 8 years, this is what you might look like. This is advanced periodontal disease. I have had dogs on the table go septic and die. They go into a cardiac arrest from the sepsis, and I've had 2. They were beagles in a research colony at the University of Illinois, where I did my residency. And they, ironically, they were there to be part of a food trial, and these were their mouths. You know, and this is so preventable, and that's the really sad thing about this is you can prevent all of this. And this is a chronic stress on the immune system. These animals feel like crap. They feel like they're always coming down with something. It hurts to chew. It hurts to eat, to drink, to breathe, because of all the inflammation and the destruction that's going on in this mouth. And it doesn't have to happen. Here's an example of a dog, just looking at it grossly before we get them on the table. And you're like, yeah, there's some stuff there, but you clean the teeth and look, you can see the roots pretty readily. So the gingiva, the gum tissue, should be all the way up to here. And that all should be covered by bone as well. So if you think back to any x-rays you've ever seen, if you see an area where there's bone lysis, you know there's a problem. Same thing in the mouth. There's no difference in dental procedures. If there's bone loss, lysis, erosion, you've got a serious problem. And I have a lot of dogs come to me with broken jaws from dental disease. We've had a couple just this week. And by the time it gets to that point, there's nothing we can do to put it together and expect primary healing. So we're left with the salvage procedure, and we have to do a mandibulectomy and just remove a portion of the jaw that's fractured, because there's no way it's going to heal. Again, very preventable. So, and this is what you'll see on the x-ray. A lot of horizontal bone loss. That's the level of the alveolar ridge or the top of the bone of the mandible. Should be up to here. You can see an abscess around that root as well. This is just an example of a discolored tooth. We call it intrinsic staining. That means the tooth is dead. Teeth should be a nice pearly white color like this one. If you look in your pet's mouth and they have something that's not that, it needs to be evaluated with some dental x-rays to see what's going on. This one you can see right there. Go back. That's that tooth. I just pointed at my screen like you guys could see that, but you can't. There's that tooth. And this is the x-ray. What you can see is basically it's resorbing, it's eroding. It's like a big cavity it's a cavity on steroids. And so you've got, you know, pulp exposure, you've got abscesses that are starting, you've got granulation tissue, inflammation. One of the hallmarks of inflammation, of course, is pain. The other thing you notice, this dog was missing a P1, a first premolar here, but we take the x-ray and there is a root here that's starting to abscess. So it's an incidental finding, but again, there's a tooth that's supposed to be there, it's not there. Take a dental x-ray, you see something that's causing the animal pain or discomfort, and we can address it. Here's a good one. Here's a broken jaw from dental disease. It's a mandible that's broken. You can see this is the first molar, that big tooth on the bottom. Big abscess here, abscess around this root, just eroded through the ventral cortex of the mandible. This tooth also is abscessed, and it doesn't take much. A lot of these are dog-on-dog trauma. Big dog bites little dog, and the jaw's in bad shape, so it fractures. Or they jump off the couch or the bed and land on their face and it snaps. Or they fall down a step. It could be any number of things. This guy also has an abscess on his upper jaw. You can see right there, it's trying to, remember that picture I showed you of the hole, the fenestration in the bone, and we can see the root where the abscess was coming out. That's what this is trying to do right here. So this dog was it's full mouth extractions and removal of a piece of his jaw. Antibiotics, I don't think we need to get into that. We do use some. Antibiotics tend to be overused in veterinary medicine in general, is my feeling, even in dentistry. So I don't use a ton of them. So we won't necessarily go over that. Analgesics, pain management is huge. We are, I like to think, on the leading edge of doing that. We use multimodal anesthesia and pain management. So we use nonsteroidals, we use opioids, we use NMDA medications, gabapentin. So we use local blocks. We'll numb these guys up inside, even though they're under anesthesia, just to stop that pathway, that pain pathway, before it even gets wound up. Oh, that's why this is in here. Okay, we don't need to go over that. This is a little puppy trauma. Another dog got onto this one, bit the front of his muzzle and kind of lifted up. So he presented to us. This is a hole in his maxilla. So that's all, a lot of it's clot, but we're looking into the nasal cavity there. And we wound up pulling out these chunks of bone with the teeth. That's what it looked like from the side. And so we cleaned it up, got the teeth out, and we were able to suture that up. And just an example, things like that are really fun, really interesting, really rewarding, because these guys do really great. It's a horrific injury, and you feel bad for them, so it's nice to be able to fix that up for them. This is a cat canine tooth with some osteomyelitis around the upper jaw. See that big, or the upper canine, that big bulge? That's not gum tissue. That's not soft tissue. That's actually bone underneath the gingiva that's infected and inflamed and expanding and causing the gum tissue to expand over it. And it's all secondary to periodontal disease. Again, totally preventable with frequent exams and cleanings. And that's just showing there's a deep pocket in an oral nasal fistula actually in that area. This is a tiger that we worked on. It's a baby tooth that was fractured, and the pulp was exposed. So you can see it's intrinsically stained. You now know that term. It's a dead tooth. It's abscessing. And again, it's trying to drain out. So you know that tooth has got to go. The other thing about that is because that's a baby tooth, that infection that's living up there and has been there for some time is now putting the permanent tooth bud at risk. It may not erupt. It may erupt with enamel defects. It may erupt and become abscessed. Baby teeth, and they're very thin walled, so they break pretty easily, and they can cause problems with the permanent teeth as well. Need to go with that. It's another tiger, same sort of thing, baby tooth, fracture with pulp exposure, had a draining tract and a large ulcerated scabbed over area on the ventral portion of his lower jaw. Another animal, again, root abscess, trying to drain out below the eye. That's a probe just kind of showing where the fistula is located. You can kind of see it right there. And then you take the x-ray and you can see there's a loss of bone density around this distal root. That's your abscess right there. Same thing in a cat. From all this accumulation, there should be about that much accumulation. And you've got this big concretion there, and it just caused an abscess. This may be the allergic dog, the dog that's been chewing on his skin or something. I just pointed at the screen again. These are all incisors. These are all incisors, and that's a canine tooth. The dark spot is pulp exposure on all these teeth. This was a dog with a history of chronic skin allergies, and he was just gnawing on his skin and wore the teeth down to the point that the pulp was exposed. The teeth are now level. He's having trouble picking up food, and he's having some pain with these teeth, all because of skin allergies. That's what the x-rays would look like. This is an upper canine tooth on a dog that's been chewing on a crate. He was crated and was chewing to try to get out. So he wore away the back part of this tooth, and eventually it can fracture. There's the pulp chamber, And you can see the back part of the tooth is much thinner than the front part of the tooth. So when I see these, we call it cage chewer syndrome. We can put a crown on it. We can build that up with a restorative material, and then we can put that's the 3/4 crown that I mentioned earlier. So it doesn't wrap all the way around the front of the tooth. The tooth is still alive, but it's protecting that tooth from any more damage. Plus, it looks pretty cool, I think. Cats are very prone to cavities. In cats, we call them resorptive lesions. But what it is an erosion of the tooth. And you can see these holes in the teeth. Very, very common, very, very painful. This is a tooth, that right there should look like this tooth here, like an M. And it's just eroded away. And that's a big granuloma in the pulp, as that is. Extremely painful. We get a lot of clients that come in with cats that we call it ADR, ain't doing right. They're kind of off their food, kind of still acting okay, just not themselves. And it's oral pain, usually from resorptive lesions. Take out the teeth, and we hear all the time, you know, she's a kitten again. More playful, more social, less aggressive sometimes. Same sort of thing here, same sort of thing there. Again, intrinsic staining, it's a dead tooth. It should be x-rayed, and if it looks okay on the x-ray, do a root canal. And that way we can save the teeth and we don't have to go through the process of extracting them. This is a developmental defect that leads to endodontic disease inside the tooth, and abscess formation. It's called Dons and Dante or Dons and vaginatus. Basically, the enamel kind of folds in on itself. And when it does, you get these little micro fissures in the enamel that allows pathogenic oral bacteria to invade the pulp system and cause infection and abscess. It's just a developmental defect. Don't really know why it happens. It's usually bilateral, affects the same tooth on both sides. And it's usually this first molar on the bottom. And you can see how those roots kind of converge from each other, and these kind of converge towards each other. I'm sorry, these diverge, and these kind of come in more straight up and down. That's what happens when the enamel folds in, it just kind of pulls those roots in together. So that's another characteristic we'll see on the x-ray. Cavities, here's a good example of cavities in the molars of a dog. These are beyond repair. We get to them early, we can drill them and fill them. If not, we have to extract them. So these are beyond repair. As is this one, there should be a whole half of the tooth here. And you can see it's discolored, granulation tissue, just looks really nasty. It looks really painful. Soft tissues in the mouth can have problems. Mucosal hyperplasia is an issue, especially in small breeds, yappy breeds that bark a lot. We call it gum chewer's disease, because what will happen is this tissue will get caught between the teeth, and to get it unstuck, these dogs will start, doing their mouth like that, and it looks like they're chewing gum. So we call it gum chewer's disease. This can be trauma related. It could just be idiopathic, meaning we don't know the cause. A lot of times it's secondary to inflammation caused by the buildup of plaque and calculus on the inside of the teeth. And it's a surgical case. We surgically resect that tissue. Here's an example of a malocclusion I mentioned earlier when we were talking about orthodontics. This canine tooth should be splayed outwards a little bit and actually interdigitate between these two teeth right here on the outside. And it's not. We call that base narrow, and it's poking a hole in and causing quite a bit of trauma to the mucosa of the hard palate. And I've seen a few of these that got so intense that they eroded the tissue in the bone and went straight into the nose. So this dog, every time he closes his mouth, basically is puncturing his nose and causing a host of problems. So we can orthodontically move those teeth or extract teeth or even shorten them. We can shorten those teeth that are causing the damage and do one of the vital pulp procedures I mentioned earlier, so we don't have to extract the tooth, but it's no longer causing trauma within the mouth. Here's an example of how we might move that teeth. Here's some baby teeth that didn't fall out, and they're causing these canines, the permanent ones, to erupt too far towards the tongue, base narrow, and they're going to cause some problems on the roof of the mouth. We can actually, here's another way to move teeth. This is an acrylic that I actually apply to the teeth while they're under anesthesia. It comes It's a self-curing acrylic. So I deliver it from a syringe and I shape it to the shape I want and it hardens. It takes probably 4 to 5 minutes for it to harden. And then I can create a groove in that acrylic. Trying to get my arrow kind of right here so that whenever the dog closes its mouth, that lower canine tooth will hit in the bottom of the groove and kind of be directed to a more normal occlusion. So we don't have a lot of clients that want to do that. I think it's a cost thing. They just want the teeth extracted, but orthodontics is an option, just so you know. This was a hit by car. So again, emergency case, you want to triage, ABCs, make sure the dog is stable, tend to any life-threatening injuries, but also look in the mouth. You look in the mouth and you can see, well, there should be a canine tooth here. There's not. This canine tooth is busted. You can see the exposed pulp there, but you got to wonder about where that tooth is and tell the client you're going to have to address this. So we did do that. We took a dental x-ray and we have, that's the nasal cavity. That canine tooth was actually pushed straight up into the nasal cavity. It's called an intrusive luxation. And we have to go in surgically and remove it, which is pretty easy to do. But there's a surgical flap that's made here. Of course, you remove the tooth, and of course, you have an oronasal fistula that you have to repair. But that should be part of the treatment planning for whatever vet sees this dog for triage and stabilization. Here's a luxated tooth, dog fight. That canine just got caught on something and got pulled sideways. It's dislocated. So the root of that tooth is right up here, and the bone that separates it from the nasal cavity is millimeters thin. So the root of that tooth is pushed, broken through the bone, is in the nasal cavity. But we can save that tooth. We can clean that area out, use digital manipulation to put it back in place, and then use a combination of wires and acrylic to splint it in place, let the tissues heal around it. The tooth is going to die because it's lost its blood supply. So when we remove the wires and acrylic, we'll do a root canal procedure on that tooth, and we can save it. Here's an x-ray of it. So you can see the widened periodontal ligament space compared to this tooth, which is normal. The periodontal ligament is the ligament that holds the tooth in the socket. It attaches on one side to the bone of the socket and on the other side to the dental tissue of the tooth. And you can see that luxated tooth right here is that ligament space is widened. Dogs that aren't eating, it could be a number of reasons. It could be viral, bacterial. It could be they're just not hungry. It could be a systemic disease, but it could also be an oral disease. This was a dog that was not eating, and he was dangerous. And we couldn't get near this dog. He was pretty aggressive. Never wrong to sedate an animal to do an oral exam. And when we did, we found this lesion on the tongue, which is abnormal, of course. So the first step would be to take a biopsy. And when we did, we found squamous cell. So this dog was not eating, number one, because he was painful. Number two, because he had cancer. And then, of course, the next step is to stage it, lymph nodes, chest x-rays, make sure that we stage the animal, and then we can meet with an oncologist and determine the best course of treatment for something like that. Here's another jaw fracture that we had seen, not secondary to periodontal disease, which is great. It means we can try to fix it. Here's the x-ray right behind the second molar. So that second molar, because it's in the fracture site, had to be extracted. So we extracted that, and then I used intraosseous wires. I had to drill a hole in the bone, but we got a wire through the bone, and then we put acrylic on the top of the teeth. And we got pretty good, actually really good approximation of the bone fragments to let that area heal. So when there's decent bone to be had, then we like to try to fix these. This is just an example of non-erupted teeth. Here on the bottom, you can see there's a thick fibrous covering of the gingiva. Again, this is something abnormal. Tooth should be there, but it's not. So you take an x-ray and you can see this is an impacted tooth. Not only is it impacted, but it's trying to come out and it can't, but the root's trying to grow. So it's actually causing erosion of the ventral cortex of that mandible. And that's the thickest part, the sturdiest part of the mandible. So this dog is not far from a jaw fracture. If this jaw gets hit just right, that jaw could fracture around this root. Even when we go in surgically to do something, that jaw could fracture. What we did was we did no perculectomy, wound up going in and basically removing the thick fibrous covering from over that tooth, closing up some of it, and then just allowing room for that tooth to erupt. The roots will continue to grow, we'll continue to monitor, but as the roots grow, they get longer and push the tooth up. And so now the bone on the ventral cortex should reestablish itself and the dog should be in fine shape. Don't know why that one's there, but okay. Oh, now I do. Yeah, this is a tooth that's fractured, but the pulp is not exposed. And again, this is primarily for veterinarians when I'm lecturing. That tooth should still be evaluated for endodontic disease. So you take an x-ray. If it looks okay radiographically, we can do an odontoplasty. We can smooth that tooth off, make sure there's no sharp edges catching against the tongue. And then we can bond a sealant. This is an acid etchant and a light cure for a sealant that we're bonding to the fractured side of the tooth, just to help protect it from anything getting in and causing further damage inside the tooth. And that's it. How did we do okay on time?
Awesome. Yeah, we're doing great on time. I would love to transition over now to our Q&A portion. We got some great questions in the chat that we have. And so I'll go ahead and get started asking our first question. So our first question is, can we see the dogs? But we already saw the dogs. So the next question would be, what are some signs that your pet would need oral surgery?
Well, it could be a lot. The number one sign of dental disease in dogs and cats is nothing, zero. And I hear that a lot. You know, my dog's still eating, still playing. It doesn't mean they're in pain. Dogs and cats are very stoic. The other thing dogs and cats are not is whiners and complainers. And it takes a lot. You know, if it was you or me with an abscess, you know, we'd be bitching and moaning about how bad it hurts. Dogs and cats don't do that. So we have to wait on symptomatology. We have to wait for some sort of clinical signs to make themselves aware, like a swelling on the face or muzzle or a draining tract. Or if they do happen to not be eating as much, ain't doing right, picking up food and dropping it, tilting their head when they eat, oral discharge. The number one thing I tell clients, pet owners, is look, there's bad breath and there's dog breath. Anything beyond dog breath means something needs to be checked out. Okay. And same thing in cats. If it's not just normal cat or dog breath, you know, if you get a whiff and you're like, oh, something is up, that's an infection that you're smelling. And it could be just periodontal disease, could be an abscess tooth, could be a tumor, could be an autoimmune disease affecting the local flora. So the best advice I give to anybody is have your pet examined every 6 months, just like we do at the dentist. Go every 6 months. And I offer that no charge to my clients. Come back every 6 months. Let me just take a peek and see where we're at. And let's clean them as needed, because throughout the life of an animal, even if it's more frequent cleanings, it's actually safer for the pet, because a cleaning is going to be 15 to 20 minutes. But a cleaning with root planing and curettage and extractions and flap surgery, that's an hour and a half of anesthesia. And it costs a hell of a lot more. So staying on top of it and preventing it is really the best thing.
Awesome, thank you. Our second question is, how often do you get bit?
Not as often as I should. Not as often as I expect. You'd be surprised. Like I said, cats and dogs are pretty stoic, and I say this every week, they are amazingly pliable and nice. If I get in, and there's some behavioral signs that vets know of, kind of pre-bite signs. You know, in cats, the ears can go back, the pupils start getting big. Not all of them will vocalize. Certain breeds are more prone to aggressive behavior or tactics. So I go in knowing that. And I operate the practice, we do what's called fear-free practice, which is a movement in veterinary medicine, which there's a lot that entails, which we don't need to get into, but basically it's designed to make the entire process of coming to the vet and being treated as stress-free and likable as possible for the pet. The clients count too, but for me, it's always been more about the pet. So we do fear food. Did I answer that, or was I digressing at that point?
No, definitely. Our next question is, I know a lot of owners often brush their dog's teeth with dog-friendly toothpaste and a toothbrush. Do you think that that's better than the dental treats or bites that they provide for animals, or would you say it's equally effective for the dogs?
Brushing is the gold standard. Nothing beats brushing. Think if you went home tonight and you didn't brush your teeth for a month, but you ate, dental friendly food. It's brushing is the gold standard. It should be done daily. Minimum, and studies have been done, minimum amount is 4 to 5 times a week. And it's easy enough to do if you're patient. It's just like undusting your TV. You're basically trying to undust the teeth. As long as it's veterinary approved toothpaste, because they don't tolerate the human toothpaste well. And the toothpaste, honestly, is there just to make it a palatable experience for the pet. That's why they're made in all these weird flavors. So they think they're getting a treat, and they're licking the brush, which means it's in their mouth. And while it's in their mouth, you just go over and you undust a few teeth, pet them, praise them, make it a play date, and then put a little more toothpaste on, give them another treat, go undust some more teeth. And most animals will accept it, if you approach it in the right way. But yeah, it should be done daily. I will say there are some treats that are effective at helping to reduce the severity of gingivitis or calculus or plaque buildup. But in and of themselves, they don't do anything. If you rinsed for scope every day for a month, but didn't brush, same analogy.
Okay, that makes sense. Our next question for you is, are dental wipes also effective to prevent tartar and cavities?
Tartar and cavities, dental wipes they're okay. It always goes back to brushing. Brushing is the ideal. There are some wipes that, may have some, if you ever used acne wipes, those can be a little bit abrasive. And some of these dental wipes act kind of the same way, but it's really the bristles of the brush that go up underneath the gum line that stops periodontal disease. But you also got to be careful of the ingredients. A lot of these products may have xylitol in them, which is very toxic to dogs and cats. A lot of them also have alcohol in them. And if you're putting something in mouth where there's inflamed tissues already and you're dumping alcohol onto it, it's not going to be a pleasant experience. And then all of a sudden, that animal's going to be head shy. And anytime you go near its mouth, it's going to recoil, and it's going to be harder to introduce something that is appropriate. I always tell my clients, if you're thinking about a product, just text me or email me a picture of the label and the ingredients, and I'll tell you what I think about it. So, and you guys are always welcome to do that too. Nina and Jason have my email. You guys are welcome to do that.
Great, thank you so much. Our next question for you is, what was the most memorable case that you've worked on?
Honestly, it's when I was in general practice, I had two. One was a dog named Dinky DeWeese. And this was maybe 20 years ago. But she came in lame. She wouldn't get up, very painful in her legs. She'd been to a couple other vets who couldn't diagnose anything. And so I admitted her to the hospital, started running some tests. And when I would get her out, she would actually walk on her front legs with her ass in the air and her back legs in the air, walking like that because the back legs hurt so much. I ultimately diagnosed her with Lyme disease. And she was having an arthropathy, polyarthropathy from tick-borne disease. The other one is my first year out of vet school. I was in general practice, and we carried beepers back then to let you know how old I am. And I got a call late at night from this guy. I was up in Connecticut near Yale University. This guy was a Yale student, and he had a gerbil that wasn't doing well. So I met him at the clinic, And this gerbil had a big tumor, and I was like, I'm sorry, the best thing is to euthanize him. We can do that humanely. And I've been in practice maybe 2 months. I was like, oh, well, hell, how do I do that? How would I euthanize something where I can't get a vein? Because you have to inject a solution. But what you do is you inject it intraperitoneal into the abdominal cavity. And so I did that. And I was standing there with this young guy, and he was crying. And I was trying to be a good vet. I was a new vet. And so I was crying with him. And we were watching this gerbil just kind of go to sleep. And then he stopped breathing. So I got my arm around this guy, and we're just both kind of sobbing and looking at this gerbil laying lifeless on the table. And then all of a sudden, the gerbil goes like that and looks up at us and does a header off the table and lands on the floor and starts kind of moving. He wasn't dead yet. And so it's not a great story, I know, but it's very memorable. So I had to give him a second injection to get him down. So
Wow.
those two would probably be it.
That's crazy. All right, our next question is, what is your bread and butter case, which would be the case that you've seen most often as a veterinary dentist?
Periodontal disease, just the accumulation of plaque and calculus causing loss of gum tissue and bone. Periodontal disease is probably 60 to 70% of my practice. And that's, like I said, that's the number one disease in veterinary medicine worldwide.
Wow. All right, our next question is, how do you deal with aggressive animals?
Carefully is the obvious answer. We, again, we use a lot of fear-free techniques. So we keep we'll turn the music down or off. We can turn the lights off so there's not a lot of external stimuli. We separate all the animals and the dogs and cats into different rooms wherever possible. We use pheromone. It's like a Glade plug-in, but it's pheromones, and it's released in the room. It also comes as a spray that we can spray in a cage or a kennel or on towels or on the dog or cat or on ourselves. And that's supposed to help calm them down. If we know ahead of time, we'll work with the referring veterinarian and the client and try to get them to give something before an oral medication before they come in. Usually it's something like trazodone or acepromazine, which is a phenothiazine tranquilizer. Gabapentin works exceptionally well in aggressive cats. And that's how we do it. We'll put on a muzzle if we have to. I teach my staff proper restraint techniques. Yeah, so those are probably the best ways I could recommend.
Definitely. Our next question is, what do you typically do with worn down teeth?
It depends. You got to get some dental x-rays and probe around those teeth. If they are periodontally sound teeth and the pulp is not exposed and they look okay on the x-ray, you just leave them. And you try to eliminate the chewing behavior, which is generally why teeth are getting worn down. Eliminate the chewing behavior that caused them to get to that point in the first place. So it's counseling the owner on what's going on in the pet's environment. But you may need to do nothing. If the pulp's exposed, we extract them or do root canal.
Okay. All right, awesome. Our next question is, when doing surgery, do you always have to put the dog to sleep or can you use an anesthetic?
Well, put the dog to sleep is a term that means something totally different to us. So we don't use that term. It's general anesthesia for everything. Yeah, we have a lot of really compliant patients, but I haven't found one yet that will sit in the chair, lean back, and hold its mouth open and let me do what I need to do. So it's general anesthesia for everything.
Okay. What is a pet quality puppy?
I imagine that question is related to the slide I showed earlier. Breeders who sell their puppies, a lot of times they're selling them to enter competitions, to be in the show ring. And so they have to be as genetically sound as possible. And if there's something that's not genetically appropriate, it's not just the teeth. You can get certification for the hips, the shoulders, the heart, the eyes. And if there's a genetic defect as determined by a specialist in that area, that breeder is not going to be able to sell the puppy for the show ring, which means it becomes pet quality. It's just going to be sold or given to somebody to be a pet.
Okay, great. Our next question is, do you regularly work with exotic pets such as tigers, or was that a rare sight?
We do them as much as possible. During my residency, which was at Illinois, there's a big cat rescue center in Indiana, which is a neighboring state. So we've done a lot of work on lions and tigers, black panthers, jaguars, cheetahs, cougars. I used to live in Columbus, and I did a lot of work out at the Columbus Zoo, which is, if you know who Jack Hanna is, that's his zoo. So we've worked on silverback gorillas. We've worked on bears of all types and sizes. We worked on some of Jack Hanna's show animals that he would take, to the TV shows. Here I work at the Nashville Zoo, and we've done some of their big cats. We've done some of their smaller animals as well.
Oh, that's awesome. Bears, that's really cool.
Yeah.
Do the same things that contribute to human cavities, sweets, too much sugar, unhealthy diet, also contribute to cavities in animals?
Yes. Absolutely.
All right, and then our next question, how do you sedate an animal that won't let you near it?
It's rare that occurs, to be honest with you. And I've been in veterinary medicine for almost 30 years now. And, I don't even need all fingers on one hand to count the number of times that's happened. But if it does happen, then we just don't work on that animal, and we'll call the owner and have them come pick the animal up. And there's two things you can do. One, which is sketching. That is, have the owner assist you in restraining the animal. And that's sketching stupid because there's some liability issues. If the animal turns around and bites the owner while we're sticking a needle in it, that's not a good sign. So I'll usually abort the procedure for the day and then talk to the referring vet and try to get something oral that the owners can give the pet before bringing it in. But it's extremely rare that we can't get an injection into a hind leg with a combination of drugs that will make them pliable so we can work with them.
Okay. Our next question is, how often do you collaborate with other vets?
Every day. Every day. I don't see any patients unless it's referred to me by a general practitioner. So we'll call and get the records from the general practitioner. They fill out a referral form. Actually, I have one here. A referral form that comes, they do that on our website, and it's emailed to us. This one just happened to be faxed, if you're not too young to know what that is. That one was faxed over, but they fill out the referral form. We call and get the records from the referring vet. If I feel like I need to speak personally with that vet, I will. A lot of veterinarians will call me on the phone and say, hey, I want to discuss a case and see if I need to send it your way, which they usually do. But, if they call, I'll talk to a veterinarian 24/7. They have my number. But it's an everyday thing. Yeah. Collaboration. I don't know all the answers. No vet does. No MD does. The more minds you can put towards an animal's well-being, the better. And I'm not afraid to ask for somebody else's thoughts on the case.
Great. Our next question is, what makes cats more prone to cavities than other animals?
Well, cats don't get cavities in the strict sense. It's called tooth resorption. And if you think of it like a cavity, you can get a mental picture of it because the tooth is eroding slowly, but it's not the same cause. We don't know what causes them. Nobody does. During my residency, there was research that was supposed to come out saying, well, it's kind of like osteoporosis in women, and it's just vitamin D, calcium metabolism will fix it. But that wasn't borne out in subsequent studies. So we don't know what causes them. There's a lot of theories. Anytime there's a lot of theories, it means that nobody knows what's going on. So cats don't really get cavities as much as they do resorptive lesions. And they found in prehistoric skulls, they found resorptive lesions in teeth from prehistoric cat skulls. I just don't know why they're occurring.
Okay. Our next question is pertaining to how you got into veterinary medicine. So what inspired you to go into this field?
That's a good story. When I was a kid, we lived in North Carolina. I was maybe 7 or 8. And the neighbors up the street had rescued a dog. They found it under their tractor. It was a little terrier mix. Think like Toto from Wizard of Oz. So they named it Track. And I got to be really good friends with Track. And so Track would wait at the end of their driveway every day for my mom's car bringing us home from school. And we'd pass their driveway and Track would run behind our car and wait for me to get out. And I'd play with Track for 20, 30 minutes and then tell Track, go home. I got to go in, and Track would run up the street to her house. And we did this every day. And I loved that dog. And Track used to like to chase cars that ran up and down the street. And I tried to get her to stop and she wouldn't. So I thought, well, I don't want to be mean to her. So I'm just going to cheer her on. And I was cheering her on and she started chasing a car, and right in front of me, she got hit. And, so I freaked out, of course, got my mom, and, they got her to a veterinarian, but she died actually while I was cheering her on to chase this car. And it just killed me. And that's the first time that I even knew what a veterinarian was. I thought, well, that's pretty cool. I'd like to do that. And so I thought about that for a while. And then I grew up and I went to school. And my priorities were not in line with that kind of rigorous academic curriculum. And that's all we'll say about that. But I just wasn't as focused on my studies. So I wound up getting a bachelor's in psychology, and I got out and I worked as a counselor. I worked in a residential treatment facility for adolescent boys. It was a wilderness facility. We used things like horseback riding and camping, ropes courses, hiking as all part of the therapy. So I did that, and then I worked in admissions for that hospital, and then marketing, and then I wound up working. I was headhunted away to become chair of a psychiatric assessment team in Atlanta. And so there was a team of like 6 or 7 PhD, MSW or social workers and me. And we would go out in the community and perform emergency assessments, like at schools, police departments. They would all call us, if somebody was on top of a parking garage threatening to jump, they'd call us to come help talk to those people and get them to the appropriate mental health resources. And I'd gotten as far as I could go in that field without going back to school to get like a PhD or a master's of social work. And I thought, well, shit, if I am going to go back to school, I've always wanted to be a vet. Now that I kind of have my act together, let's do that. And so I did. And so I had to do 2 more years of undergrad to get the prerequisites to apply to vet school. And so I went to Auburn for that, and wound up getting another bachelor's in animal science. This time graduating with honors, where I hadn't before, and then got accepted to vet school. And so that's how that happened.
Great. And then just building off of that, we had a question about, you talked about how you did general practitioner for a bit within veterinary. How do you become specialized in oral surgery?
Specialized in anything, it's a residency, much like on the human side. It's typically a 3-year residency. I did mine in 2 years. Mine was the last of the 2-year residencies within the dental college. It's not quite the same as on the human side. You don't have to go straight into an internship. Folks that know they want to specialize will do that. Some of the more competitive specialties like surgery, they may have to do 2 internships or a general internship and then a specialty internship with a surgeon. In a lot of the specialty colleges, several years in general practice will equate to a 1-year internship. So I was in general practice for about 5 years and decided for various reasons. What I really decided was, in veterinary medicine, veterinarians have to be everything. Got to be a urologist, nephrologist, surgeon, dermatologist, internist, radiologist. We got to do dentist. And it is really difficult to be good at all those things. And I was just of the mindset where that wasn't adequate. That wasn't cutting it for me. I didn't want to be pretty good at all these things. I want to be really good at one thing. And so I decided to go do a residency. And my years in practice alleviated the need for me to do an internship. And so I got the residency and spent 2 years. But like I said, most of them are 3 years. And then you have to pass an exam. The dental college, it was a 2.5-day exam. There was, it was 8 hours of written exam, 4 hours of a bench exam, and then 8 hours of surgical procedures on cadaver specimens. And you had to pass all parts in order to become boarded.
Wow, that's very long. We have a question regarding personal zoos. So what are your thoughts on personal zoos? For example, Joe Exotic?
Stupid, useless, dangerous, maybe abusive. There's no reason that any yahoo on Main Street needs to have a tiger, much less a whole bunch of them. It's stupid. Sorry.
Great. No. And then we have some questions regarding what is the difference between regular dog breath and bad breath? How would you differentiate those?
If your dog is panting and you wouldn't put your face right up to his nose and leave it for a minute without going, oh, come on, then it's bad breath. All right. All right, go smell a puppy's breath. Just go to PetSmart, get out a puppy and smell their breath. Anything different from that, something's going on.
Okay.
All right. Morning breath. Think morning breath. Right?
What is your opinion on owners giving their dogs raw bones?
I don't like it. I don't like it for a couple reasons. I'm not a big fan of raw diets. Most veterinarians are not. The biggest reason for that, which ties into the medical field, because there's a lot of zoonotic diseases, so a lot of things. And as a veterinarian, you never know if your client has HIV, has AIDS, has had an organ transplant, and is on immunosuppressive drugs, has some other condition that alters their immune system. Cat bites, for example, are notoriously nasty. Cat scratch fever is a real thing. It's caused by bacteria called Bartonella. So cat scratch fever is a zoonotic thing. Toxoplasmosis in cats is a huge thing. I'm sorry, what was the question?
It was pertaining to raw diet.
Oh, raw. So that's one reason why I don't like raw, is because there is some contamination potential with raw diets in people. E. coli, salmonella being the big ones. The other thing, the reason I don't like raw and bones is they're just too hard. Bones, if they're small bones, they can splinter and then they can cause a foreign body reaction in the mouth, or they can go into the GI tract and cause a perforation, or they can get stuck in the GI tract or stuck in the esophagus, or they can break teeth. So there's a lot of reasons not to do that.
Our next question, what ingredients should owners look for specifically when buying toothpaste and toothbrushes at stores?
The toothbrush, I mean, you can just go, certainly you can go to PetSmart or Walmart. You can go to Kroger, you can go to any store. Depending on the size of the pet, you can get a kid's toothbrush and use that. I do carry cat-sized toothbrushes. Those are going to be veterinary only, obviously. And I have medium and large toothbrushes. Just make sure it's soft bristles. Run it under warm water before you go in the mouth to soften it up even more. Not hot water, but warm water. And change it every 3 to 6 months, like you would your own. As far as ingredients in toothpaste, the ingredients don't matter because it's the brush that's doing the work. What you're looking for in a veterinary toothpaste is a flavor that your pet will allow you to put the brush in the mouth. There are some toothpastes that have an enzymatic ingredient or property, and they may provide some additional benefit, but that's minimal. So it's really the palatability of the toothpaste and a soft bristle toothbrush.
Great. Could you talk a little bit about the admissions process to become a veterinarian?
Probably not the current process. I can talk to you about it when I went in. Everything's done online and everything is different. I'm asked occasionally to write a letter of recommendation or reference for my employees that may be applying to vet school. And they talk about doing it online, and it's You have to pay for each one, but the application is sent to several different veterinary schools. Back when I did it, I had to write an essay, you know, why do you want to be a vet sort of thing. I did not have to take any like MCAT. I didn't have to take any of those tests. I honestly don't know if anything like that, the GRE, is required at this point for veterinary students. I do know that veterinary school is more competitive than medical school, only because there's fewer veterinary schools, and just in the ratio of people that are applying to the number of slots that are available, they've said for years and years that veterinary school is more competitive in that fashion. And it is probably 70 to 80% women at this point.
Wow, that's awesome.
Yeah.
We have a question. Do you support using CBD for pets?
Yeah, absolutely. For people too. You know, there's a lot of products. My general rule of thumb is if it won't hurt and it might help, and you've got a little bit of research to back it up. I'm all about evidence-based medicine and looking at the literature. You don't just do something because you can or you think it might help. If you have something that will back up the claim, especially if it's an off-label use. If it's not specifically approved for cats or dogs, it's off-label, and you got to have a pretty damn good reason for using it in case there are some side effects. But yeah, absolutely. As a matter of fact, I prescribe it for some of my patients.
Great. And we're nearing the end of our shadowing session. So at this time, I just would like to ask if you have any last advice for our pre-vet students who are joining us today.
If you are pre-vet students, this is something that goes around time and time again. And I hate to end on kind of a dark note, but there's one of the big things that a lot of folks don't anticipate having to deal with when they get into veterinary medicine and some other medical related fields is something called compassion fatigue. And it's a recognized disorder. And it leads to anxiety, it leads to depression. Veterinarians as a profession are at the top of the list of suicides. Veterinarians and dentists typically are 1 and 2. I happen to be both, so go figure. But compassion fatigue is a real thing because most people get into veterinary medicine because they love animals, which is the wrong reason to do it. You got to love science and medicine, and you got to have a heart for animals. You have to have compassion and empathy for people as well. And that's very draining. And veterinary clients are very, very demanding, much more so, I think, than on the medical side, the human medicine side. You know, and I mean, I hear reports from veterinarians daily about clients cussing them out, you know, calling them names. There's social media harassment and bullying that goes on daily. There's a worldwide movement. It's called Not One More Vet, that is designed to help alleviate some of the difficulties that veterinarians have in dealing with the emotions and the frustrations. A lot of it stems from, you know, somebody brings in a sick dog and you're able to treat it, but the owner elects not to treat, just wants to take the dog home, or can't afford to treat. You know, on the human side of things, there's insurance, and that's not, you know, all over the place, but you get a lot more insurance payments than we do in veterinary medicine, and it affects the type of medicine we can practice, and that can be very draining. So if you're thinking about going into veterinary medicine, get into it for the right reason. Spend some time shadowing with actual veterinarians. Spend some time at a shelter. You know, don't just play with puppies and kittens, because that's not what we do all day. There is a lot of animal suffering that we maximize the amount of animal suffering that we see by becoming a vet. And that's ironic considering the type of people who want to get into veterinary medicine. So that's what I would say. Just know what you're getting into, ask questions, shadow some vets, and, you know, figure it out.
Great.
Cool.
Thank you so much.
Thanks for having me.
That was a great presentation. For my students, don't forget to head over to our website and you can actually comment on this talk. So if you found any part of today's talk that resonated with you, if you had any key takeaways, go ahead and let us know. We would love to hear about it.
Nina?
Yes.
I'm sorry to interrupt. If you want, you've got my email address and you're welcome to share that with the group. If anybody has any other questions or more personal questions, you guys are welcome to reach out to me, okay?
Great, thank you so much. Did you want to drop that in the chat? For our
yeah, right now? Yeah.
Yeah, if you're able to. Thank you.
Oh,
That's
yeah,
awesome.
here it is. Cool.
Great resource, guys. This is a great resource for you guys if you have any questions about anything related to veterinary practice. Just an announcement for anybody. If you're interested in joining our team, we are taking applications. We are a relatively new program. We just launched about 2 months ago. And so you can be the start of a great movement. You can apply through our website. There's a QR code here that will take you directly to that. And yes, but if you do not feel like you have the time because you are doing school, you have life, you have work, anything, that is okay. You still want to get involved, we have volunteer opportunities available. You can sign up on our website. You can work on your own schedule, your own time, for as many or as little hours as your schedule provides you. This is also found on our website. Under the contact tab, you will see the join our team or sign up to be a volunteer. My next announcement is to follow us on Instagram. This will allow you to get updates of all of our speakers, as well as free resources that you guys can utilize, just that we have found around the web. We like to collectively make a story for them and make those available for you all. We have a challenge for you today. Please head over to our Instagram page to Dr. Keith Stein's post. And if you guys are able to spell his last name letter by letter, you will be eligible to be picked for the Spotlight Student of the Session. And you must do it without interruption. So good luck. Our next shadowing session is on Monday, November 16th at 5 p.m. Pacific Standard Time. And I just want to thank you guys all for joining us today. If you would like to get your certificate verifying your shadowing hours, you can do so by taking the post-shadowing assessment. The post-shadowing assessment can be found on our website. If you go to Dr. Keith Stein's profile, to the right of his picture, you will see the Take This Course button. Once you click that, you will be led to our module where you will have 15 minutes to complete the quiz. You must get a score of 70% or higher to be eligible to receive your certificate. Once you pass with a 70% or higher, you must go back to the original speakers page and click Finish Course. If you do not click Finish Course, you will not receive your certificate, so please ensure you've done so. Once you click Finish Course, you will be able to download your certificate immediately, or you can always find it in your profile under the Certificates tab. If you guys have any questions about this or experience any issues, feel free to reach out to us at info@prehealthshadowing.com, and we'll be sure to get back to you as soon as we can. Thank you all for joining us today, and this concludes our virtual shadowing session. I hope to see you all on Monday, and have a great evening.